This video is about the Inflation Reduction Act of 2022, but I won't discuss inflation at all. That's appropriate, since the new law doesn't address inflation either, except in its title. Instead, this video will discuss how that new law affects ACA and Medicare. I'm not going to call the new law by its misnomered title, and I will not use the abbreviation IRA, since that means something entirely different to those of us saving for retirement or in retirement. Instead, I'm going to talk about several small portions of the new tax and spend law that will affect many retirees who buy health insurance before and after Medicare. Stay tuned. So for those of you who buy pre-Medicare coverage on the Affordable Care Act marketplace, the 273-page new law includes just 143 words that will affect about 14 million of you using the advanced premium tax credits. Here's the big change. This one subsection C extends the broader premium tax credits for another 3 years through 2025. As originally written, the Affordable Care Act included premium tax credits for those who earned less than 400% of the federal poverty level. Now that's a number that changes each year based on the size of a household. If you earned $1 more than those levels, you received no help and likely faced unaffordable health care premiums. This hard limit was once known as the subsidy cliff. When I was retired more than 6 years ago, I first used my COBRA rights to extend group health care coverage for 18 months, while my 2 children were on the plan. Now, that was an expensive choice, as I've outlined before in prior videos. But as COBRA ended and my children had their own health insurance, we switched to the Affordable Care Act coverage for my wife and I. And we managed to keep retirement withdrawals and other income to low enough to ensure that we did not go over the subsidy cliff. Now, in 2020, for instance, that limit was about $69,000 in modified adjusted gross income, or MAGI, for the 2 of us. If we went over that level, we would lose all premium subsidies for health care, and the insurance costs would more than double. The American Public Rescue Act of 2021 changed the formula. Now, that was mostly a COVID-19 relief act, but it included a whole section on expanding the Obamacare and turning it into Biden Care. It extended the premium tax credits by temporarily removing the 400% poverty level limit for 2021 and 2022. The new formula assured anyone buying health care on the ACA marketplace would pay no more than 8.5% of their income on health care premiums. So that relieved us of limiting our income to that $70,000 or so level for 2021 and 2022. We could now take more income and do some Roth conversions and still get some help on our health care premiums. Now, without those added premium credits, about 14 million people would have faced substantially higher premiums in 2023. In 2022, for instance, the 400% of federal poverty level would be about $54,360 for an individual and $73,240 for a couple. Now, this chart from the Kaiser Family Foundation illustrates the subsidy cliff for a 60-year-old individual who would pay a substantial portion of income for health care without the ACA premium tax credits. Now, I'm going to put a few links below to resources at the Kaiser Family Foundation's website explaining this ACA extension for another 3 years. Now, in my case, I'm covered by original Medicare and Medigap insurance, but we are still buying ACA coverage for Marie for another 3 years through 2025. So this change is going to mean a lot to us personally. Now, as I've covered in a prior video, these tax credits, when you apply them to only one person buying insurance, don't go as far as you think. And that's because you're still defining your household income for the two of us, but only buying one coverage. And we've found out that it now costs Marie as much for her insurance as it used to cost both of us to buy insurance on the ACA. So for another 3 years, we're going to face those ACA charges, and the premium tax credits are going to help a lot. Now, here is a summary by year of what we've paid for medical insurance. And as you can see, we started out on COBRA, which was probably not the best choice. We switched to ACA coverage, and the costs were based on how much income we chose to take each year. And then with the premium tax credits extended in 21 and 22, we were able to take more income. Now we are in that catch-22 phase where we're paying both ACA coverage and Medicare insurance and Medigap insurance. I estimate when you add all of that together, we will spend about $12,000 this year, and that's more than we were spending in 2020. Now, if you are an early retiree with more than 2 people, maybe your kids are on your plan too, you definitely want to take a look at the ACA premium tax credits to see if that works for you, particularly if you're facing that choice between COBRA or ACA. It could add up to thousands of dollars in added premium costs if you don't go for the ACA premium tax credits. Now, you could look at different scenarios on this Kaiser Family Foundation website and see what makes sense for you. You may be able to take more income and apply it to a Roth conversion. Now, I will tell you that based on my experience, you'll also want to do some role modeling in the final enrollment sites, either the healthcare.gov or your own state's marketplace sites. I have found that the Kaiser site shows about $100 less than the real costs here in New Jersey. Now, waiving that 400% on the premium tax credits for another 3 years definitely gives you more opportunity to structure your retirement income and perhaps take targeted Roth conversions for these next 3 years. And that will lower RMDs later in your retirement. Now, the new law also includes several changes that will apply to Medicare Part D prescription drug coverage. And I'm going to go through those, again, with the help of Kaiser Family Foundation. They summarize these changes as the following. The new law allows Medicare to negotiate prices for a limited number of brand name drugs starting in 2026. The new law also eliminates 5% coinsurance for catastrophic coverage in the Part D plans beginning in 2024, and then adds a $2,000 a year cap on out-of-pocket spending under Part D plans beginning with 2025. Now, limits to the annual increase for Part D premiums will be 6% from 2024 through 2030. The new law also limits monthly cost sharing for insulin products to $35 a month for those people on Medicare who are using this drug for diabetes. The new law also expands eligibility for the Medicare Part D low income subsidy benefits, and that helps those that are close to the poverty level afford Part D coverage. The new law also eliminates the cost sharing for adult vaccines under Part D, And it improves access to adult vaccines for everyone under Medicaid and CHIP programs as well. For many seniors, this means that we will not pay a copay for that shingles vaccine under our Part D plans beginning next year. Now, how much these Part D plan changes affect you really depends on what prescription drugs you use. The Kaiser Family Foundation estimates that about 1.4 million had more than $2,000 in out-of-pocket prescription drug expenses in 2020. And that sounds like a lot. As context, in 2021, about 48 million of the 62 million covered by Medicare were also enrolled in a standalone Part D plan or a Medicare Advantage plan that had drug coverage too. So less than 3% of that 48 million with Part D coverage spent more than $2,000 on prescription drugs in a given year. CMS estimates 3.3 million Medicare recipients take insulin, so capping the insulin will help that small share of participants. And the Kaiser Family Foundation estimates that more than 4 million received a vaccine under Part D plans in 2020. So that gives you a sense of how many people will be benefiting from that change. For a majority of those of us on Medicare using a small number of generic drugs, these changes will not matter. The limit on premium increases from 2024 to 2030 to 6% may affect us, but keep in mind the average premium only increased about 5% in 2022 to about $32 a month. In late July, CMS had estimated that the average premiums would decline slightly in 2023. So that 6% increase from 2024 to 2030 sounds like it might become a self-fulfilling prophecy for all of us. I'll conclude with my standard warning. I am not a financial planner. I am not an insurance agent. I have no special initials after my name. So take these as entertaining ideas from one educated consumer to another. Always do your own due diligence and seek out a professional if you need one. See you next time.